Hi there, thank you for joining me for these videos today. I'm coming to you wearing two hats, one as a family physician at the Oshawa Clinic, Cordis Health Center, and second is pastor of People's Worship Center at 215 Kennedy Road, Scarborough. I want to do these videos to address some concerns pertaining to the COVID vaccine. There are many questions out there, many concerns pertaining to these vaccines. Actually, WHO, World Health Organization, has identified vaccine hesitancy as one of 10 global health threats. So, and this was even before COVID. WHO states that, well, vaccines can prevent as much as 2 to 3 million deaths every single year. So, just to help us to have some sort of confidence in vaccines, I want to review with us a short history of vaccines. Evidence exists that, well, the Chinese employed smallpox inoculation as early as 1000 AD. In 1796, Edward Jenner began to use cowpox material to create immunity to smallpox. And his method was improved over the next 200 years and it eventually resulted in the eradication of smallpox. And that's the reason why we don't have smallpox today, all because of the vaccinations. In 1885, Louis Pasteur began to work on a rabies vaccine, and that also made a huge impact. Made a huge impact on human disease. In the 1930s, and that's when things really began to take off in vaccine development. There were the polio vaccine trials and later on whooping cough. The middle of the 20th century was a very active time for vaccine research and development. Methods for growing viruses in the lab led to rapid discoveries, innovations, and that included the creation of vaccines for polio. Then the researchers began to target other common childhood diseases such as measles, mumps, rubella, and the vaccines for these diseases resulted in quite a tremendous reduction in the burden of the diseases among us today. When we have a newborn in the office at 2 months old, the child is brought back into the office for vaccinations, for well baby check and vaccinations. And they receive vaccines at 2, 4, 6, 12, 15, 18 months, and also at 4 to 6 years. So vaccines are commonly done in infancy, and then when kids are 13, they also get some more vaccines, 14 to 16 more shots, and so on. These vaccines that we've been doing for the babies has resulted in these diseases almost being, you don't hear about them. We do have a few cases of chickenpox still. We would see that from time to time, and many of these children or people were not immunized. One of the questions people would have as well, these COVID-19 vaccines, how come they've been developed so quickly? And is there something fishy going on there? Well, they were developed quickly because of the severity of this pandemic. But there weren't any safety steps that were skipped. And they were developed quickly also because of all of the advances in science. And then there was this international collaboration. There was increased funding. It's just the governments and the international agencies just pulled all the stops to funding. And they work together to get these vaccines available and to reduce, to curb the curve on this pandemic. One of the interesting things we should probably look at is something called the knowledge doubling curve. Buckminster Fuller, he created the knowledge doubling curve. And what he noticed was that until 1900, human knowledge actually doubled approximately every century, 100 years. Then by the end of World War II, it was doubling every 25 years. Today, nanotechnology is doubling every 2 years, and clinical knowledge, which would be more relevant to us, that is doubling every 18 months. On the average, human knowledge is doubling every 13 months, but according to IBM and the build out of the internet, that will lead to the doubling of knowledge every 12 hours, not 12 days or 12 months, but every 12 hours. So do we have enough patients who were studied with these vaccines? So I want to compare the COVID-19 vaccine to one we commonly use in the office, the shingles vaccine for patients over 50 to protect them from shingles, which is not going to kill them, but definitely can result in a lot of pain for patients. So in the shingles vaccine study, 14,000 patients were studied. Compare that to the Pfizer COVID-19 vaccine, where 43,000 patients were studied. 43,000 compared that to 17,000, to 14,000. And many people just go ahead and get their shingles shot without too many questions asked. I mean, shingles is not going to kill you, but COVID-19 can. Um, to date, we've got 1.4 billion vaccinations being done for COVID-19. And as you can see in countries like the UK, Israel, the USA, things are beginning to change and beginning to normalize. So, and that's because they've turned this corner because of the rollout of vaccinations. They've been very aggressive with doing that. But it's not to say, well, okay, well, these vaccines have been studied, and that's it. That's the end of the story. But there's also what you call phase 4 trials, where we have post-marketing surveillance after the vaccines are out there and being administered. And the vaccine is monitored for safety, for more side effects, and for efficacy after they have been approved and made available to the public. So how do we know the vaccines are safe? Well, Health Canada is only going to authorize the use of a safe vaccine. Canada is recognized around the world for its high standards and rigorous methods that they go through, all the rigor they approach these vaccines, the trials with, and all the data for any other medication. So the vaccines are not going to give anyone COVID-19 because it doesn't contain the virus, just to let you know that. And another thing we need to know is that the vaccines will not alter your DNA. The mRNA vaccines do not alter, they do not get into the nucleus of the cell to alter your DNA. So there's a lot of misinformation around that out there. In my next video, I'm gonna address the emergency use question. So we will ask, well, why these vaccines have only been approved for emergency use. It means as if, you know, all the rigorous steps were actually passed over, all the safety wasn't looked at, and so on. So I'm going to talk about that in another video. Thanks for looking.